My name's Felix Ho. I am currently at Charles Sturt University. Grew up in Perth, so I would say I'm a city kid by trade, so to speak. Mainly lived in the cities most of my life, but I really wanted to do something different. Car rate Force Mobile. Currently now on placement in Alice Springs for 1 month placement. Wanted to come down to Alice just to get a different exposure. I'm normally based up in Darwin. This placement was arranged through St John Ambulance. They've been extremely supportive and they've assisted me with a fairly generous allowance actually, and they've found accommodation for me.
I'm Rachel Jenkins. My placement is in Katherine. I've always wanted to study nursing since I was kind of a teenager. I'm in my 3rd year of Bachelor of Nursing, and this placement is part of my developmental disability subject. I'm only on a week placement.
My name's Joshua Crace and I'm on a rural medical placement in Mareeba in Far North Queensland.
I think the view's pretty spectacular, so hopefully I won't notice going over.
There you go now, mate.
Yeah, I'm realising what I've done, I think, right about now, so... What do you call this jump?
Running roof jump.
Running roof jump.
4, 3, 2, 1!
Awesome. BP 147 on 107. That's the machine.
You measured that, did you?
That's the machine.
Okay.
So in our course, we get to experience a reasonable amount of general practice, but I'd heard a lot about rural generalists and the fact that they can, go and work in emergency and also go and do obstetrics or anaesthetics and that sort of thing. And I wanted to see what that was all about and see the variation you can get in general practice. My previous degree was computer engineering, and I thought that was where I was headed for the rest of my life. And I studied in Adelaide and certainly enjoyed living in Adelaide, and following that San Francisco, and then came back to work in Melbourne. I initially thought that cities would be for me for the rest of my life.
Is this your first one taken off, or has Dr. Panta attacked you a few times?
Doctor I've been placed with, his name's Dr. Panta, and he's been a fantastic mentor. This is the end of my 4th week in total, and even in those 4 weeks I've learnt so much from him.
Just adjust the lights a bit, Josh, you don't know.
And he's mentored me and taught me a lot of procedures which I didn't know before, and certainly helped me along my journey throughout medicine.
I enjoy teaching, and so when this opportunity came, I jumped at it. And Josh is a great guy. He's a lovely man to teach. He's very willing and very interested in country medicine, and so I think it's benefited both of us.
Yellow ball. You think you'll find it? I've always been interested in rural nursing, so I wanted to come really just to make an informed decision whether I wanted to do it or not. Rural nursing interests me because when you're a rural nurse, you're more kind of generalish. You need to know a bit about everything, so you're not just kind of on a surgical ward. You need to know medical, surgical, paediatrics, most probably a bit of midwifery, know a bit of everything. Oh, I like that.
Yeah, his blood pressure's a bit high. I'm just wondering if I just start taking a look at your hands. Is that all right? Thank you. Yeah, I find that the bigger the hospital, the more the hierarchy. So I actually prefer the more rural hospitals because they're actually a bit of a flatter structure. I guess as a medical student, in larger hospitals, it's hard to feel like an extra set of hands. In many ways, you sort of feel a bit lost in what's going on around you. But in a rural setting, you can get in and help out. On all of the country placements I've been on, you're a welcome member of the team right from the start. Okay, that's okay.
And in some places, you may be there just with nurses, so there's no actual doctor on site. And whilst that's very challenging, you can learn a lot from the nurses and you feel quite included in the team, and they consult you for your opinion even at this stage in the degree.
We're just heading out to the airport to meet with a Royal Flying Doctor's aircraft. We're picking up a female patient. Basically, an adult female patient who's just been transferred from one of the communities, having kidney pain at the moment, and we're just transferring her in just for her assessment. She's also pregnant as well, so yeah, we'll take her into Alice Springs Hospital and see how it goes. I've received some Indigenous training up in Darwin, but the Indigenous people up in Darwin is different from the Indigenous cultures in Alice Springs and the surrounding areas, so it's been difficult interacting. They've got different languages, they have different customs, different ways, how they relate to their own internal, like their pain, how they express their pain, how they express their own signs and symptoms, especially in Western holistic medicine, so to speak.
I think it's actually better than I expected, Catherine. I thought it was going to be sort of more remote, because it looks remote on the map, but it's only 3 hours from Darwin. I've never experienced the wet season before. My first day here, I got absolutely soaked. I rode my bike to Woolworths to get some food, and by the time I got back, I was drenched completely all the way through. I've never seen rain like it in my life. But it was an enjoyable experience cycling in the rain.
Waiting, James, stop.
The University of Wollongong arranged my placement through Charles Darwin University. They arranged mostly everything for me apart from my flight, which that's all I had to do. They arranged all the accommodation, and so yeah, it was pretty simple. It was Charles Darwin University who set me up horse riding, because they run a Jackaroos course. It's been good fun. Went out today with a couple of the guys on the course with a little ride round, and they were all really nice. Been riding all my life, so I just wanted to try it here. Motivations to come out here, I guess it was just to experience rural nursing and rural life, something that I've always wanted to do. Reservations, maybe just leaving my family behind. I got a son, Sam, who's 6. Oh, that's fantastic. I really miss my family, but they ring every night. I miss you too, baby. Can't wait to see you. Okay, love you loads. Bye. And they miss me too, apparently.
I just had a patient come in with some chest pain and also some pain in the tummy. So we're just trying to figure out whether he had some gastrointestinal problems or whether it was heart related. Ceftriaxone versus benzylpenicillin. Yep. Why are they giving both? I thought they'd be similar.
Because you'll actually get a much better coverage for strep pyogenes with penicillin with ceftriaxone.
Oh, right. I think it's challenging. Every time you take history and physical exam from a patient, it's challenging.
Tell me about this gentleman.
Sure, okay. Bill's a 57-year-old male, and he's come in today with a half an hour history of... It's good to have Dr. Panta alongside to give tips and advice, and also to, particularly when eliciting signs and figuring out those sort of things from patients during the physical exam, it's good to have someone to confirm what you've found. So. Yeah, so...
You know which side your bread is buttered, Josh, you're Chris, don't you?
Sorry. The good thing about a 2-week rural placement is that you've got 3 weekends there that you can play with. Really good opportunity to interact with the community. Very nice to do this for a job. You're actually meeting people and getting out there and experiencing rural life for all that it can be.